In what is believed to be the first study to measure the impact of Uber and other ride-booking services on the U.S. ambulance business, 2 researchers have concluded that ambulance usage is dropping across the country. A research paper released Wednesday examined ambulance usage rates in 766 U.S. cities in 43 states as Uber entered their markets from 2013 to 2015. Co-authors David Slutsky, an assistant professor of economics at the University of Kansas, and Dr. Leon Mosk et al., an internist at Scripps Mercy Hospital in San Diego, said they believe their study is the first to explain a trend that until now has only been discussed anecdotally. Comparing ambulance volumes before and after Uber became available in each city, the 2 men found that the ambulance usage rate dipped significantly. Slutsky said after using different methodologies to obtain the most conservative decline in ambulance usage, the researchers calculated the drop to be at least 7%. My guess is it will go up a little bit and stabilize at 10% to 15% as Uber continues to expand as an alternative for people, Mosk et al. Said. Slutsky said he and Mosk et al. Are submitting the paper to journals for peer review. San Francisco-based Uber quickly distanced itself from the notion that hailing an Uber driver is an acceptable substitute for calling an ambulance. "We're grateful our service has helped people get to where they're going when they need it the most," said company spokesman Andrew Hosboon. However, it's important to note that Uber is not a substitute for law enforcement or medical professionals. In the event of any medical emergency, we always encourage people to call 911. Mosk et al., however, said many patients tend to be pretty good at assessing their state and how quickly they need to come in and how sick they are. But at least one prominent Bay Area emergency room physician disagreed. Paul Kivala, president of the 37,000-member American College of Emergency Physicians, said he believes that for those low-risk patients who can't drive themselves to the emergency room, Uber is a good service. But many people, he said, may not be able to differentiate between a life-threatening emergency and an innocuous medical issue. So, he said, calling 911 is always the safest bet. A paramedic has the training and the ability to deliver life-saving care en route, Kivala said. Where I really have a hard time is believing an Uber driver is going to attend to you. Kivala noted that in addition to his work as an ER doctor at Queen of the Valley Medical Center in Napa, he is also the medical director of an ambulance company in Solano County. The researchers, however, insisted that ride-booking services such as Uber and San Francisco-based Lyft can sometimes be the best way to get to the hospital in a hurry. Previous research, Mosk et al. Said, suggests that a fair number of people are using ambulances to get to the hospital because they simply don't have another way to get there, particularly those who live in areas with limited taxi service. And, Slutsky added, with healthcare taking a big chunk out of most people's budgets, many consumers these days have to weigh a few factors before calling an ambulance. They have to think about their health and what it's going to cost me, he said.